Good morning. This is
Morning.
Amy Wheeler, and I'm here with Melaney Seacat from Tucson, Arizona. Welcome, Melaney.
Thank you.
So, Melaney, I've invited you on this webinar because I just think you have something really amazing to share with the world. And when you were at our Optimal State of Living mental health training last January and in July, I realized that you are well trained not only in yoga therapy in the Krishnamacharya tradition, which of course I love and I've also been part of for so many years, but you're also really well trained in somatic experiencing, and you have this really unique way of bringing together these two different traditions, if you will. Can you say a little bit about how your yoga therapy knowledge and your somatic experiencing knowledge have informed each other?
Yes, so thank you. And so my training is with you in the Krishnamacharya tradition. And when I started my training as a yoga therapist, I started a parallel track in somatic experiencing. And I did that because I realized I was new to working in a clinical setting, working in a therapeutic setting, helping people. And that this was going to give me perhaps a little more grounding in looking at a person through the lens of a nervous system, which, you know, my understanding from my exposure to yoga therapy is that this is a big part of what we're actually doing. And so this was in a way a complement and a further enhancement of my ability to assess people. And so along the way, so I've trained in the somatic experiencing modality through an intermediate level 3, and it goes all the way up through 2 courses in advancement. And so I'm still
through Peter Levine, yes?
This is through Peter Levine, and his somatic experiencing technique is based in polyvagal theory, which you've talked about on previous Facebook seminars, which is a very sophisticated understanding of how the nervous system works. And I'm not going to be talking about polyvagal theory. I'm going to try to keep this pretty simple and basic so that we can draw some connections. But also, he's really studied a lot animals in the wild, and some of his ethology influences were people like Konrad Lorenz, who are great ecologists looking at how animals behave in the wild. And so his view of how these animals perform in the wild, coupled with his study in psychotherapy and looking at different methodologies to help people move into what was coined by one of his teachers, Eugene Gendlin, as the felt sense, helped him develop this methodology for understanding the nervous system and understanding that, and much like yoga therapy, the nervous system and our bodies are naturally wired for resolution and healing. And so what we can do, and what we do in yoga therapy, is we really support these natural biological processes. And so the somatic experiencing approach has great complementarity to the yoga therapy approach and enhances my ability to observe a client, assess a client from a nervous system perspective, and to understand some of the underpinnings, some of the motor self-protective responses, natural instinctual responses that are going on, and what we're doing in the yoga therapy realm is somehow helping people access a natural cycle of their nervous system. So, you know, we know that in the wild, let's just come back to our nervous system. So we have the sympathetic nervous system and the parasympathetic, simplistically, right? And the sympathetic nervous system is the activation side of things, and parasympathetic deactivation, rest and digest. So if you want to look at, say, a gazelle, the classic example, the gazelle in the wild, and the herd of gazelle is grazing peacefully, and the wind picks up, and they hear this rustling in the branches. So their nervous system activates and they begin to look around. This is a natural thing. We all do this, the orienting response. And they see that there's no danger. So mild arousal, mild activation, their nervous system comes right back down, right? They're in a rest and digest mode again. And then a little while later, something louder happens. A twig branch breaks. And this louder noise also creates a startle response. Again, they stop what they're doing, they look around, and they're in hypervigilance now. So now their nervous system is activating at a higher level. There's more stress hormones, the adrenal system is online. They're ready to flee if they need to. Well, sure enough, a tiger jumps out of the woods and they have to run. So they're in flight mode, full on flight mode, and all of their sympathetic nervous system is in high arousal, high activation. They run, they get away because they got, a weak animal or a baby or something. And the herd gets away from the danger. And so they stop. And once again, they repeat this orienting behavior. And they look around, they see that it's all as well, and their body shakes and twitches. And this is the discharge, this is the deactivation cycle. So they've cycled up to a high level of activation as appropriate, and now they're coming back down. And that shaking is the completion of that activation cycle. And once that is complete, they're now back into their parasympathetic. They've completed that cycle and they're in rest and digest. No trauma. So animals in the wild are rarely traumatized.
So I want to stop there and unpack some of this juiciness that you're offering to us, because what you've just said is nature. It's how it is supposed to work. That when there's a mild threat, you'll have a mild response. When there's a moderate threat, you'll have a moderate response. When there's really a threat, you'll jump and do what you need to do to get away. Right. And then after each one of these, you'll come down into parasympathetic and come back again. And as human beings, I don't see that happening. Right. With a lot of people in our society, and especially the people that show up for yoga therapy that have high anxiety, high depression, post-traumatic stress disorder, these types of things, trauma, their nervous systems aren't doing that. And that's why I think yoga therapy is so, so effective, because through yoga therapy, we help them to respond, that help their nervous system to respond appropriately to the different stimuli of life. And instead of when there's a mild threat, a lot of people, because their baseline level of stress is so high, I call that the allostatic load is so high, that even a mild threat sends them so high into their sympathetic. And not only do they go up and respond or react too much, but they can't get back down. They don't know how to get back down. And so a lot of us just end up living in the sympathetic nervous system all day, every day from 5 a.m. to 10 p.m. And we don't know how to get down into the parasympathetic. And I think that's where yoga therapy is such a beautiful, beautiful thing, because this is what we're teaching people to do. Wouldn't you say?
Exactly. And then understanding it at a nervous system level, what's happening there is that, so first off, this idea that it's not the event. It's not the event. So a child in a hospital can have this situation in which their nervous system gets overwhelmed. Something happens that is so scary that their nervous system can't naturally come back down, and they get stuck on. And they never deactivate that. That gets stored in their tissues, right? That's
in their nervous system.
In their nervous system. That's stored in their nervous system. And so that becomes triggered by similar circumstances later on in life. And sometimes it happens a lot later in life. Well, shell-shocked veteran can have the exact same symptoms. We tend to think that trauma is for these major events, but really we live in such a stressful society, and we don't have the cohesion that we did of the tribe and the family to deal with the natural events that happen in life that are stressful and traumatizing. And so yes, we are as a culture, as a society, and this is globally, overactivated, overstimulated, and there's this attraction to that. We get so used to that we actually become kind of addicted to it. And so
that's the new normal.
That's the new normal. And we don't even know that we're doing it. And so, yes, yoga therapy brings in this wonderful toolbox that's ancient, that's rooted in this ancient lens of yoga and Ayurveda. And what we're doing, and you have brought this to the forefront with your optimal state of living assessment tool, is looking at the gunas, which are these qualities in the system that the ancients say these qualities are reflections of these core elements of earth, air, fire, water, and earth and space that all have qualities, the guna qualities. They're always changing.
Yes.
Normal. It's human nature. They're in fluctuation, right? And so when we attune to these guna qualities, both within our own system, within the system of the people we're working with, when we help and educate our students to using your tool of the optimal state of assessment tool to say, where are you in this mix of qualities, mentally, emotionally, and physically? We are helping them to have number one, a witness consciousness. There's no judgment about it.
Yep.
Then as we work with them, as we give them a direct experience through yoga, because this is, again, tying it back to the nervous system, the resolution of trauma is in the body. It's not in the...
Can you say that again? It's not in the mind.
Yeah.
I was trained in psychology. That's my PhD is in education and psychology. And I love talk therapy. I do talk therapy myself when I'm having trouble.
Right.
But the healing of the nervous system to react differently, to respond differently, to go up and down appropriately and get out of the sympathetic, it's not going to happen through the prefrontal cortex. It's not going to happen in the mind. It's exactly what you said, which is we have to have an experience. We have to feel our nervous system come down. And I know you know this, I'm just repeating it, that it's the experiential quality of yoga therapy when you understand from the inside out, oh, that's what the relaxation response feels like.
Exactly. And the beauty about yoga therapy, and I now appreciate it so much, understanding more about the nervous system, is this gradual approach. So we do a great job of having an enormous toolbox. It is not just movement. You know, a yoga class can be very activating, just like a walk or strong exercise can overstimulate a nervous system. We're always meeting the student right where they are, and right where they are is right where their nervous system is. So when we understand these cycles of activation and deactivation, and we can assess a person and see from a guna quality perspective what's happening, but then also underneath that, also understanding there's some nervous system and some sensory based things that are going on. And even in their story, we can hear fight, flight, and freeze showing up. So we can hear these things. We can then access this very broad toolbox that doesn't necessarily look like a strong yoga practice, right? We can start with an orienting kind of a yoga practice where we say, you know, hey, let's do some finger nyasa. Let's just get access to some very physical things here. This is taking us out of what orienting does, is it takes you out of this self-referencing of going inward and ruminating and being in your head and telling your story and being activated like that. And it gets you out into the environment. Well, if you're in a room with somebody, they might not be able to look out. It might be kind of a sterile room, who knows? But there's other things you can do. You can orient to, how does it feel to sit on this chair? Can you access the sense of sitting on a chair? Can you just feel the fingers and the breath? Can you feel the inhale and the exhale, the inhale and activation cycle, the exhale and deactivation cycle? And you can begin to start very small. And in the somatic experiencing training, they really emphasize what we do in yoga therapy. They say, first ground and stabilize the parasympathetic nervous system.
Feel safe.
Get them to feel safe. Get them to have access to that. If somebody's in an anxiety state, they may be disassociated, right? And they may not be able to go straight into a strong asana practice. So you have to do some things to stabilize and calm. And that may look like sandwiching some movement to deactivate with some things to activate, and discharge with some things to deactivate. That's mimicking the oscillating pattern of the nervous system. We do this so well in yoga therapy.
We do it well. Like we might do a posture and then lie down and rest and feel.
Exactly.
Right? Or do a pranayama and then sit for a moment and experience that. So you've said so many things that I wanted to pick up on. And number one is, you know, in our training, a lot of times we talk about these childhood ACE scores. And you had said that a lot of times when we think of trauma, we think of a big event that happened, as opposed to many, many small events that happened, right? And so my argument is always that I think all of us have trauma from our childhood, whether we have these big events that you might see on the ACE score, like sexual abuse or your parent getting put in prison or a divorce, you know, these types of big events that we we look at from the adverse childhood experiences, questionnaire that we can use. But there are so many things that happen in childhood, just little, what people might even not even notice as a traumatic event. But over time, if a child has to walk on eggshells because they're not sure if the parent's going to have an anger outburst, or their mom and dad are going to start fighting again tonight, or something, like all these little things also get stored in your nervous system. So I always say that almost all of us have trauma. None of us has gotten out of our childhood without these things that are stored in our nervous system.
Yeah.
And to think about using yoga therapy as a tool to kind of reset the nervous system through the breath, through movement, through sensing or feeling your body. You mentioned people being disembodied. A lot of times response to trauma is that we are no longer embodied. We no longer feel anything from the neck down. We run into benches, and we overexercise without feeling what's happening. We overeat. We don't have hunger signals. We don't have bathroom signals to tell us, hey, it's you've been holding it for 10 hours now. We've almost checked out of our bodies. And what I hear you saying through yoga therapy and somatic experiencing is that this is a way to reattune to your body, right? That even something like this, you're reattuning. You're exhale, 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 inhale, 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 inhale. It seems so simple,
Right.
but it's a way to bring us back in. And then when you re-enter, all of those sensations that you were trying to avoid through disembodiment come back. And that's a time where you need to be held. And you, like you said, you need to feel safe.
Right.
You need to have someone there
Right.
that when you come back in for the first time in 45 years and all the tears come, that someone is kind and caring and holds space for you to re-enter and re-embody yourself. What do you think about that?
Well, that's exactly it. And when you think about the natural oscillation of the nervous system, and you're attuning to the person, you can start to see activation cycles. So, we stabilize. We do a great job in yoga of stabilizing a person, of helping them get into a parasympathetic relaxation response state. And when that happens, implicitly, the nervous system is going to activate up again. This is what we have to remember, is that within every parasympathetic dominant state, there is a sympathetic state wanting to appear.
And so why is that? Tell us why that is.
Because that's how we're wired. Our nervous system is always wired to cycle up and then to be able to complete. It's the inability to complete the deactivation cycle that keeps us locked on. Right. And so we have this fight, flight, and freeze, which are natural self-protective motor, responses to threats. And so, and if we can't fight and we can't flee, and there is an overwhelming event, our nervous system can shut down. And what's happening there is you get into an immobility or a freeze state, right? Where the nervous system is either both locked on and shut down. So it's like the accelerator in a car going on and the brake at the same time. And this is highly, disorganized.
Problematic.
Problematic and disorganizing.
Yeah.
And the symptoms of that could look like exhaustion, little affect, disembodied, depressed, low energy, all of these things. And, you can start to gradually, in a very gradual way, uncouple that. So if you're working with somebody who are showing those symptoms, one thing that's really important that I've learned from a nervous system perspective is that when you get them really grounded and stabilized, what can happen is a very big activation can show up. And that can be very scary for them, and it can be re-traumatizing. So to be very sensitive to managing that threshold of activation and having all of our tools at the ready to help them, do a minor release and then come back down. And so crying is a beautiful example of a discharge. And somebody, gets that softness, gets that state of relaxation, that opening, something emerges, something comes up that needs to be seen in that moment. helping that person experience that, but then helping them resolve that by coming back into their body. And somatic experiencing uses orienting, a very stepwise approach to orienting, and it's very similar to yoga therapy. And I've learned as well that the importance of this gradual approach. And so, number one, getting into a non-self-referencing mode. Number
and
two,
can I just,
yeah,
I just want to, there's so many good little bits here that I want to go to. So you said sadness or some tears might be one thing that happens, but it could also be a huge anger outburst.
mm-hmm.
It could be, there's a lot of ways. It could be shaking, it could be trembling, it could be, there's a lot of ways that once you go into your parasympathetic nervous system and you cycle back up. I mean, I've seen this with veterans, that if we bring them too deeply into the parasympathetic before they're ready to deal with what is going to come up, and in yoga we call that a vasana, right? A kind of a emotional imprint that has been stuck in there and it's going to come up and emerge. If we take them down too fast into a very, very deep parasympathetic state, the rebound is just as, like you said, it can be re-traumatizing.
Right.
So this idea of titrating, where you bring them down a little bit, let them have some feelings come up, feel that, be with it, make it safe again, try it again, gradually over time. That's how you reorganize the nervous system. And it's many events over years.
Yes.
Right?
Yes. And, I'll give you an example of, a student that I've worked with recently who I spent, had a lot of trauma, a lot of stress in her life, very anxious, had a situation at work where, she was feeling abused, actually. She had a very difficult boss. She was going into meetings and being demeaned. She felt demeaned. She felt criticized. And also having a lot of work laid on her. And it was creating a situation where initially in the story, there was this sense of fight, this sense of, okay, so irritation showed up. She was getting really irritated and angry. So that's a fight response. So I understand now from a nervous system perspective, that's a fight response. So
and can I just say that's a pitta response? Because the fight,
yeah.
flight, or flee,
Yeah.
freeze is connected to the gunas too. So the
Right.
fight is the pitta.
That's right, the pitta. And it's healthy. I mean, if somebody is, coming at you and they're threatening, this can be a psychological threat, and it's a self-protective thing. It's a survival thing. Yeah. So having compassion for that she's having this instinctual reaction that's rooted in her nervous system, that she doesn't feel safe, okay? Mm-hmm. So helping her to witness that from the perspective of the gunas, from the perspective of, our lens in yoga therapy would be the optimal state of living model, for example, and understanding that these mental emotional qualities of red zone, pitta, are showing up. That neutralizes it. That creates a sense of, yes, this is happening. I'm acknowledging it. And we're contextualizing it. There's no judgment here. So you have some connection to what's going on. Then you can bring them in this very titrated, gradual process of saying, oh, now, can you stop for a minute? And one of the things I'd done with this person is I said, do I have permission to, experiment with some, different things, like maybe, stop you and give you an experience of something? Because in yoga, we're really experiential. And so can we be a little playful here? And are you open to that? And, I get agreement with that ahead of time, right? And then, so this fight response comes up and I say, okay, so let's just stop for a minute. And can you feel that in your body? Is there any part of your body? What are you noticing? What's arising for you? And giving them some encouragement to explore that. Yeah. Well, then I could bring them up to, say, a Virabhadrasana, warrior one at the wall. So we know that we have this basic motor reflex, okay? So it's a startle reflex that we learn in infancy, that happens in infancy, that, you get startled, you stop, the baby stops, and then an extension happens, and then perhaps, followed by some crying or something like this. This is a natural, self-protective, instinctual thing. So what do we do in yoga, in Warrior One at the wall, right? We are having the hands at the wall, right? inhaling, one foot in front of the other, inhaling, we're leaning in, and then we're exhaling, pushing against that wall. That pushing away is a fight response. It's self-protective. And
Right.
a great way. And so I've done this where you push against the wall, do that a few times, and now let's stop. And now what are you feeling in your body?
Yeah.
And this helps them attune to their felt sense, to their understanding that their body is giving them important messages, and that they can listen to their body, and that they have some agency, they have some ability to self-regulate. And that at the same time, by listening to their body and being in their felt sense and tracking that sensation in the body, they're supporting a deactivation cycle, and they're letting it complete. And so what we do so well in yoga therapy is we help slow it down.
Yep.
Our tradition is so strong. We slow the movement down. We focus on the breath, which gets us into our mind, into our body. And this gives people so much ability to go through this oscillating cycle, activate and deactivate, and really come back down. So,
and I want to say, I know there may be some clinical psychologists watching this saying, oh my gosh, they're going deep. What are they qualified to do this? And I want to say a lot of times we are doing our work on the nervous system, but we also require that they're seeing a clinical psychologist at the same time.
absolutely.
So whatever's coming up in yoga therapy, there is also another person that they can go to and talk through this with and have as a support system.
Yes, and that is so important. And that's what I've appreciated is that, I'm not in this session, I'm not doing SE. I'm not an SE practitioner doing SE, but the nervous system awareness is informing my understanding of what a yoga intervention can offer. I am seeing activation. I'm understanding it from a nervous system perspective, and I'm understanding these self-protective motor responses. So it's helping me choose an intervention that's really appropriate, and slowing it down and helping them come back into their body after one standing asana, when they're ready, after they've had a lot of experience of being able to even be in that way of sensory-based felt sense awareness, which can take time.
And I want to say that too, the level of depth and breadth and sophistication that you, Melaney, are working with people on. This is why you can't just be a psychotherapist who took a 200-hour group yoga teacher training. Right. That doesn't make you a yoga therapist. What we're talking about in the optimal state trainings and what you're offering as one of our faculty members, this is very sophisticated, deep work, right? And this is why the whole training, all 9 of our faculty members, all are trained in Krishnamacharya tradition. We are all on the same page, reinforcing the same concepts, practicing the same concepts, because it's really deep work. It's not a buffet table of tools and techniques that you just throw out. There's a lot of sophistication to what you're talking about.
Right, it is. It's incredibly powerful. Yoga, the things that we do in yoga to help stabilize a person in their parasympathetic nervous system, and to help them develop that witness consciousness, really, as the Yoga Sutras say, the source and solution to our suffering is in the mind. And to constantly bring their awareness into the body, this idea of bringing the awareness into the body and seeing what's going on and acknowledging it. That is a potent field of healing. And from a nervous system perspective, it really is allowing that implicit instinctual oscillation of the nervous system to take place with awareness. And this is where the healing happens. And when we can get that to really come online, that's resiliency, right? That's
right.
capacity. Yeah.
And it's self-empowered. One of the big things that we really love to reinforce over and over again with our optimal state system is you've got these charts that are basically helping the person to recognize where they are at, and then they can learn the tools that are appropriate for that particular zone. So if they're out of balance in the fight zone, the red zone, well, using warrior pose is a beautiful way to do that, right? But if they're out of balance, say in the flight or flee, what we call the white zone, some people would call that vata imbalance, there's a whole different set of tools and techniques that when they realize they're in that state, that they can apply to bring themselves back into balance. And then the same with the blue zone or freeze,
Right.
also known as kapha imbalance. There's certain tools and technologies that we use to get back into balance. So the yoga therapy begins with the yoga therapist teaching the client, okay, when you recognize you're in the red zone, these are the tools you need to use. When you recognize you're in the white zone, this is what you're going to use. When you recognize you're in the blue zone, this is what you're going to use. But eventually it's a self-empowered practice where the person themselves puts that chart on their refrigerator and says, oh, I'm in the, I got a flee zone, the white zone. And so Melaney told me I should be doing exhale-based pranayamas and lying down work on the floor. And I know how to take care of myself when I'm in this state.
Exactly. And having an understanding of these qualities and how they're reflected in their body. So really coming back to the body, tracking all the time, like this is something I do all the time now is I track. So coming into this interview with you, I'm like, okay, I can feel this tension here. I can feel this tightness here. I'm a little nervous. So let's just stop and put my feet on the ground and just be aware and acknowledge my body's telling me that. So, okay, with compassion, I'm not.
And thank you, body. Thank you for giving me these signals.
And then I can connect to my breath and just the smooth breathing, and then I can maybe gradually begin to deepen the breath, deepen the exhale, feel the inhale. Oh, my state's shifted, and then when that happens, this is what happens spontaneously is insights emerge. Not just sympathetic nervous system, but deeper meaning and insights. This is the real self-empowerment is we become our own teacher. And this is the beauty of it that I see in my students and that I've found so profoundly in myself is how much understanding I get by, having this capacity now to self-regulate, to not be switched on all the time, to have the self-awareness that I can actually on the spot get things to deactivate, but I can also have compassion that when I'm activating, it's my body's wisdom, and that there may be something in that I need to honor and just acknowledge, and just maybe not change, just notice and stay with it for a little bit, and because that activation really could be a discharge.
Absolutely. It's really kind of getting to know yourself again as an adult. All the unconscious thoughts and patterns that have emerged as a result of our traumatized nervous systems, it's a chance to go back and revisit and say, is that really true? Am I unsafe? Do I need to have such a big reaction to this event? And seeing it from a clear perspective. I think that's a big thing that we do in yoga therapy is it's called viveka, where you get clarity that, I don't need to be reacting this way at this time. Like maybe in the past that was appropriate, but now I don't need to react in that way. And starting to kind of reformat not just the nervous system, but eventually through the philosophies of yoga, reformatting how it is that you perceive the world, how you communicate to others, how you think about yourself in this world. All of that comes from yoga philosophy. And that to me has been very healing too, that I can heal my nervous system with the asana and pranayama and all of these things, but I also have meditation and yoga philosophy to kind of reformat how it is that I think.
Yes. Yeah. And you brought up the example of a flight response. Well, from a motor, one of our, basic motor patterns for flight is this flexion, right? So the flexing of the limbs, right?
Yeah.
Flexing and contraction. Well, if you see that show up in a person, either through their story or whatever, you see a flight response, there might be so much anxiety that it's not time to really go into a highly concentrated yoga practice, but instead, perhaps in our yoga therapy toolbox, we have so many other tools available. We have visualization, right? Imagery. We have sound, which could be a very nice form of orienting to help them get out of their head, but into a vibratory feeling in their body that is a little bit different from what do you notice right now, which can be activating if somebody's very, very anxious. And we have all this range of lifestyle and behavioral strategies that we can work with, right? So we could see, for example, the same person comes in who's got this abusive boss, and they just want to get out of the room. So they're telling their story. And so you hear that, you say, well, okay, so let's create a strategy here for what if, and this actually came to me through a friend of mine who's a very advanced yogi. And I thought, this is a brilliant strategy for flight, right? What if you were to have your husband call you in the middle of the session, 15 minutes into your meeting. And if you're having that urgency, that impulse to flee, you can say, gosh, I just got a call from my husband and there's an emergency and I'm sorry, but I have to go. And then have them visualize that and say, what would that be like? What are you feeling? What would that be like? So this is yoga therapy. This is using other strategies to deal with how is a person going to come down from that flight response and have the ability to discharge that and to come back down, to manage that threshold. So it's coming up. Now I have a tool to manage that threshold and come back down and deactivate. So,
and then knowing, this is a big one for me. After I've had something very stressful and I can feel my body, I can just feel it in my body. Now I know, oh, Amy, you need to physically and somatically deactivate. It's not enough to be like, okay, don't stress out. Like, I have to go do something. I have to go for a walk. I have to do a little bit of yoga. I have to do something that kind of removes it from my nervous system. Just like you said, the animal kind of shakes after it's safe again.
Yeah.
I've really come to understand that after any period of stress, I need a deactivation in a very physical way. And it doesn't have to be an hour run. Like I said, I could just walk my dog around the block, or I could do 2 or 3 yoga postures, but the deactivation needs to happen.
Mm-hmm. Yes, yes. And the deactivation can be something to resolve a flight response or a fight response. A freeze response is interesting because there's such a bound energy in the body with freeze. And, so if somebody is in a truly, low affect state and they're not very engaged and they're, kind of apathetic, not a lot of emotional tone, you'll see this in the body as low muscle tone, things like this. One of the things that we do so well in yoga therapy is these, very simple things. So you had mentioned finger nyasa, right? Mm-hmm. So this is something that you can do. It's like an orienting thing. It's not in their head, it's in their body. They're starting to regulate their breath, which is going to activate their parasympathetic nervous system, right? You can have them just listen for sounds and orient to sound in the external environment. You can have them feel their feet and their sit bones, these kinds of things. Very, very basic things to, help a person. And then understanding that, then you may do some movement. Something might come up that's activating. Well, a threshold management could be, instead of letting them go back into their story and get all wound up, is, okay, now let's do some standing postures. And then let's come back down. And then maybe they might be ready to actually go inward and say, what's happening inside my body now? Yeah. And something that we could say that I've learned from SE is a really non-threatening, easy thing is, how do you feel overall, right? Yeah. Versus, what sensations do you notice? That's a little bit more deeper into the felt sense. But that's where we're getting them. We're getting them to really access what is going on in their body. And we can do that in the moments where after we've done some movement and some breath work and we've created some stability, we can bring them into a place of accessing that felt sense with awareness and compassion.
I love that. I mean, my classic line is, whether we're doing a posture or it's after and we're kind of resting, is, what are you feeling now? Right. And they don't even have to tell me, because it's not important that I know. It's important that they know and that they check in. And I'll tell you, the people who are in the freeze, meaning they've tried to fight, they realize they can't win, then they tried to run, flight, they realize, oh gosh, I'm not going to get away, or, for whatever reason, I'm stuck here. Then you freeze. So you've tried 2 other things and now you're frozen, like the animal playing dead. According to Peter Levine's work, the animal, once it realizes that it's not going to get away, it just goes floppy while the other animal,
Yeah.
comes on top of it. And then hopefully that animal will get bored and leave, and then gets up and shakes it off. But I guess my point is, once you're in this, what I call the blue zone, or you could say kapha imbalance, there's some connections there. Once you're in that, you don't really feel anymore. You are that numb, floppy animal that has lost all feeling. And so when you ask somebody, what are you feeling now? I found a lot of times they don't know.
That's right.
They say, I don't know what I'm feeling.
Mm-hmm.
Okay. And then I might have to cue them and say, do you feel sadness? No, I don't think it's sadness. Do you feel resentment? No, I don't think, and because they are so numbed out as a response to survival, they don't know what they feel. So that's a really interesting thing. That's where nonviolent communication has come in for me. You have this whole list from Marshall Rosenberg of feelings and this whole list of needs. And I pull out those feelings and needs sheets and say, okay, you don't know what you're feeling, but let's look at these different emotions and these different needs and start getting you reconnected again to yourself.
Yeah, that's beautiful. Yeah.
So, I mean, yoga therapy is the core of what we do, but like you're saying, yours is informed by somatic experiencing. Mine is informed by my psychology background and nonviolent communication. There's a lot of little tangential things that can go to support the yoga therapy that we're doing.
Exactly. And, again, I think it's yoga therapies, the power of our tools in this Krishnamacharya tradition for slowing down the movement, slowing down our, ability to have the mind in the body. That is what they're doing in somatic experiencing as well. It's that really bringing that awareness, and it's that witness consciousness. And I just think that is the magic. That's the magic where renegotiation of stress and trauma happens. And we're really just supporting our biology, our natural inherent biology, to become resilient, to activate as appropriate and deactivate. And
I love that. Activate as appropriate, because the sympathetic nervous system is not all bad.
Right.
You use it correctly and appropriately for the threat, and then you get back out.
Right. Yeah.
And the other thing that I'm just sitting here thinking, Melaney, is, the program is about 3 years long, our yoga therapy certification program. And I think something that's different for our program is that we as faculty, we as students, we are working on our own nervous system restructuring while we learn to help others. So you're not just sitting in a classroom listening to a lecture for 2 years. We have 3 practices a day that we're teaching one another and practicing on one another and actually feeling this work. And we're required to do a daily practice every day where we deactivate our nervous system. And so the changes that I see in students from start to finish in 3 years, and I think it takes about 2 to 3 years to really restructure your nervous system, especially if you've had a lot of trauma. But that change is such a beautiful thing to see, that even as high-level yogis, a lot of us, after years of yoga, are still not able to get down into the parasympathetic. We're still completely activated at all times. So one of the things I like about our program, it's, a little more personal, a little smaller. There's a lot of hands-on experience where you yourself get to heal from the inside out.
Absolutely. Yeah. The program, the Optimal State of Living program, has been amazing for me because, it helped deepen my access to this very deep, this ancient yoga philosophy, and how do you really bring that into our work as yoga therapists? And it starts with ourselves. It starts with experiencing our own self from that witness consciousness and having that direct experience of what is actually going on, and then trying out all of these methods, all the tools and techniques, which is so broad and so nuanced for regulating ourselves, for getting ourselves stable, and for resolving some of these things that we all have. And so it does require that self-study and the self-reflection piece. And the more you do that, the more we help our students do that. So, you know, the intake process. I love intake. I now think of intake as something we do every time. Like, where are you today?
Right.
And helping the students understand somatically what are the revelations that are coming up for them, and really tease that apart. That's that self-efficacy piece, that piece of building in their understanding of all this good work that they're doing, this empowerment of, yeah, you did all of these practices and now you're having this experience. Isn't that interesting? And really getting curious about that. So, yeah.
And this to me is very, very different than a yoga class, which is wonderful and can get us into the parasympathetic nervous system. But when you actually have a practice that is written specifically for you, the exact pranayama that will work for you to get out of your sympathetic, the exact postures, the sequence, the objects of meditation that are just for you to get out of sympathetic and down into parasympathetic, it works so quickly and efficiently. I mean, most of the yoga therapy practices aren't more than 20 or 30 minutes a day because they're so targeted for that person.
Right. And I love that about our tradition, the emphasis on the efficiency of the practice. So they're elegant, they're efficient. We only have so much attention span in our Vata deranged society, in our zone, you know, and also for somebody like me anyway, you know, I'm in an age of life situation, and people in my age of life and beyond, you know, will have focus problems. So we have to keep the practice short so that we get their one-pointed focus. We get them to really have this one-pointed focus, which I think one of the beautiful things is now knowing that that one-pointed focus, that directing the mind in the chosen direction, has this effect of calming every level of our system. And that having that happen in a practice is the art, and I think the science of it from a nervous system perspective, of how effective we are. And they don't have to be long practices. They just have to be well designed, effective, and appropriate for the person.
And that's one thing I want to say is, you know, if the yoga therapist in training is not doing their practice, is not using the tools correctly, say, oh, I want to be a yoga therapist, but I'm still going to do this inappropriate practice every day. I'm still going to go do something that throws me into my sympathetic nervous system for an hour and a half, and then I'll be a yoga therapist over here. It just doesn't work. You as a yoga therapist have to be majority of your life living in parasympathetic nervous system to be an effective yoga therapist.
Yeah, and so one of the things I've gained from somatic experiencing training is this practice of tracking. Like not just tracking when I'm activated, but tracking when I'm not activated. And just constantly reconnecting to, you know, what is going on in my body right now? What am I noticing in the body? And we tend to get in our heads and stay there, and we stay stuck there. So this constant reintegration of my mind into my body is something that yoga therapy trains us to do. But I realize that that is essential for me if I'm going to be supportive to somebody, to know what I'm feeling. Also, you know, we know that when we get in front of a student, there's this concept of merging versus joining. That this languaging is from my somatic experiencing training. But, you know, we're trained as well, you know, you've trained us in this in yoga therapy training that I've done with you, about how do you sit with a client and really attune to them? And how do you mirror them? How do you listen and reflect back to them what they're saying? How do you use affirming and encouraging and empowering language, right? How do you say yes and? Okay, so, and this is the way in which we join to their nervous system as well. You know, if somebody is sitting like this and we sit like this in front of them, you know, we're joining with them, we're mirroring them. Crossing their legs, we can cross our legs. This is happening at a very instinctual level in our reptilian brain. And the more we do that, the more we connect with them deeply and at the level of their nervous system, the more effective we are. We're building that really deeper relationship, which is, yeah.
I have a term that I'm coining for that called not merging with your nervous system. I'm drawing a blank on what it is right now. Shared nervous system, a shared nervous system.
I like that a lot. I like that a lot. And, you know, one of the cautionary notes, though, is that we have to be careful about merging. You know,
Yes.
that's what is theirs is theirs, what is ours is ours.
Yeah.
Boundary issues are, you know, this is getting into psychotherapy, and I'm not a psychotherapist, but when there is a rupture in somebody's nervous system, that's a boundary break, a break in a boundary. And there can be real issues with our students not having good boundaries.
Yep.
So it's really important to to do our own practice so that we can have our good boundaries and not fall into that, transference and projection
and you know, we talk about all of that in the yoga therapy training, even though we're not psychotherapists.
Yeah.
We have to know that transference will happen,
Right.
that projection will happen, right? That there are boundaries between teacher and student. The other thing I want to say is this is not a yoga therapy training where we have like the hierarchy of guru, and like I've chosen to move away from that model. I'm much more interested in how can I be present to this human being? How can I hold space for this human being? Instead of I'm the teacher and I'm in a hierarchical nature over the student and you should do what I say. Anytime someone wants to like call me their guru or even tease about it, I just immediately say, no, that's not what we're doing here, right? Because to me, that's not when healing happens. Mm-hmm. Healing happens when you gently and kindly hold space for someone to do their own work and self-empower them to do their work. Mm-hmm. And you're basically, the guide on the side. You're helping, you're giving some ideas, but ultimately it's their experience and it's all about them.
Exactly.
And having good boundaries while we do that. So important. Yeah. Mm-hmm. So anything else that's kind of sticking out, Melaney, that you're like, there's one more thing I want to get across about the connection between somatic experiencing and yoga therapy? Is there anything that's kind of coming to mind that you feel we need to discuss?
Well, I really love the optimal state of living model. That to me is such an accessible way to and a wonderful lens that marries up so nicely with a nervous system perspective to see the person and also to help the person see themselves in a very non-judgmental way. And so, this is based in such ancient philosophy. This is not something that you just pull up and said, let's do this. And
I didn't think of this.
Yeah, no, you put it together as a tool for assessing, and I'm using it constantly now because it really does help people. So, and you look at the gold zone, and I love it when my students say, well, I'm really in the gold, and it's like, that's the qualities of the gold zone: the clarity, the sense of relaxed alertness, the sense of being embodied, the sense of having energy and lightness and space. Not being all constricted. All of those things, those get into the sensory-based language. Yeah. And when people identify with that, well, that's telling me they are in a regulated nervous system state. So yay.
100%. Gold zone is regulated nervous system. And the whole idea behind the way that I teach yoga therapy is that I want to self-empower the client or the student to use the tools that we offer to get themselves in the gold zone as much as possible and to live from there and realize, I'm getting out. Okay, let's pull it back in. I mean, all day long, I'm doing practices. I notice myself getting up and I'm like, okay, pull that back, right? I mean, I do probably 6-7 little mini practices a day when I notice myself getting pulled into a fighting zone or oh my gosh, I'm freezing because I don't feel like I can do anything, or oh my gosh, I want to run and get away. Like I'm just constantly using my yoga therapy to pull me back in.
Yeah. And that's our interventions in yoga therapy are very, very effective for stabilizing this parasympathetic nervous system state and recognizing that it's natural for ourselves to get activated. And the question is, are we getting into an over threshold, overstimulated state that we really do need to come in, intervene, and bring ourselves down? Or do we need to maybe allow that activation to percolate and then come back down? Let it express itself, let it discharge,
Right.
Yeah.
And what I love about having people as sophisticated and knowledgeable and embodied in the practice like you are on our faculty. I mean, we have 9 amazing women that have been doing work like this for decades, and we're all reinforcing the same concepts that you and I have been talking about today. It always comes back to yoga philosophy, and now we know somatic experiencing has a lot of the similar concepts. It all comes back to the nervous system. How are we going to keep the nervous system in balance? We know that when your autonomic nervous system is out of balance, this causes inflammation. This causes all the major diseases of heart disease and diabetes and all the things that we suffer from. So this is really important, amazing work that we're doing, because if we can teach people to have a balanced nervous system, imagine the trajectory of 10 years, 20 years, 30 years, 40 years, 50 years. Imagine the disease pathology that we can kind of rein back in. So I love it that we're always coming back to reinforcing these concepts. And I call it the connection between yoga, neuroscience, and Ayurveda. Like those 3 things come together at this point. And in the model, the optimal state model, we're always coming back to, how do we get you in balance? How do you get yourself in balance? And you get 3 years of that. By the end, you're like, oh, I totally know how to do this. You don't feel discombobulated. You don't feel like, what should I use? What shouldn't I use?
Yeah. And one of the things that just came up for me too is this idea that our nervous system and our biology, our physiobiology, is so intelligent, and that somehow what we're doing is helping it come online, getting to the point where they say it's the autonomic nervous system. So that means it is involuntary.
Yeah.
So what is our body saying to us? And what is going on? And really stopping and allowing this invitational language of allowing the body to be right where it is, to have a very direct experience of it. And when somebody has a relative level of stability and they have a reasonable threshold of activation, we don't have to come right in and stop that. We can help them access that in their body. And just by this is the empowerment piece, just by having a direct experience of what is going on and training in that is working with the nervous system, with the natural biology to do what it needs to do. And then to shepherd that threshold so that, maybe it doesn't go any higher. And maybe if it starts to go up over threshold, we're sensitive to that. And we can then, appropriately bring them back down and let them complete that cycle. So this, again, it's this natural pendulation. We're not just trying to get people to be relaxed all the time.
I want to reinforce that. There's this idea that you just have to relax people. Relax. That's really not what we're doing. We're helping them raise awareness and consciousness around the cycle, the natural cycle that will happen, that we cannot stop it from happening. This is the cycle of the gunas. As long as you're alive, they're going to cycle. But how are you going to be with that? How are you going to feel? How are you going to manage it? How are you going to respond to that natural cycle that's going to happen?
Right, with compassion, with awareness, compassion, with non-judgment. Everything that's happening to us makes a lot of sense. And when you look at it as we're all just doing the best we can here, and our biology and our nervous systems are, going through their different cycles, and these guna qualities are rooted in who we are as human beings. They're rooted in the natural elements, and we have so much ability to resolve trauma and stress. We have so much capacity. We're biologically wired for it. It's such a hopeful.
It is.
Right. Yeah.
Well, I think that hopeful note is where we should end today. I do want to say, Melaney, you're on our faculty, but you're also a yoga therapist that has your own business. You do mentoring of yoga therapists as well as just regular people who might come in for back pain or anything else. You are an amazing yoga therapist apart from the optimal state of living faculty. So is there anything that you would like to tell us about your business, or if someone wanted, if they were inspired by you, if they wanted to get a hold of you, is there anything, any way that we could find you?
Sure. I mean, I can give you my email address. I have a website.
Why don't you just give the website so that we're not putting your email address all over the world?
Yeah. So my website is www.seacatyoga.com.
And that is Seacat.
Yes,
Seacatyoga.com.
Yeah, and I hope that I remember. I actually just created my website.
Okay, well, if you can't find Melaney, go to www.amywheeler.com.
Yeah.
And there is a contact us page, and just say, I really want to get in touch with Melaney, and I'll make sure that you find her.
I guess the only thing I just want to add is that it is my passion and it is my calling. I was really called to do this work because I had a horrible traumatic accident that left me in a wheelchair for 3 months. I fell off a cliff and broke my pelvis. And I had the ability to learn these self-empowering tools. I worked with a great yoga therapist, and I learned these self-empowering tools. I was able to actually acknowledge that I had trauma. And I was encouraged to work with a psychotherapist. And so I have always paired my yoga therapy with psychotherapy work. It's really, really important. The stuff that's coming up when we do yoga therapy, the potential for us to get insights and to also have difficult things come up is so supported by working with people in the psychotherapy community. But that my passion is for teaching people what I've learned about this, because these tools are powerful. And it's now, a very deep part of my lifestyle, my spiritual path, and just my healthcare path. So I love working with people.
Well, and that is what an acharya is, the person who's walked the path before you. You had a life-changing accident, being in a wheelchair for 3 months with a broken pelvis. I mean, and having used these tools to come out of that into a place of health and contentment and spiritual connection, that's a very, very powerful experience for you to share with others.
And I think the thing that we can do in yoga therapy that is really unique is, some of the things is, number one, this ongoing practice. It's not, we're just going to see a therapist for a little while and then we're on our own. We really can give people life skills for the rest of their life. And if they want to continue with this as a lifestyle path, it doesn't mean that they see a yoga therapist every week. Maybe they see them once every 6 months at a certain point to give an update and say, where are you now? And how can we use these tools of yoga therapy? And then they can have their own practice that they do. But it's this idea that when we are working with our students, we are giving them things to do. We're giving them practices. And it might be something like a simple lifestyle strategy. I might just say to somebody who really needs to work on accessing sensation, every 3 times a day, track your body, notice what's happening. It could be that simple. And that's a yoga intervention, but it's also something that is informed by my understanding of the nervous system and this language of the sensory-based language in our bodies.
Yeah. And I think that's the real key to why yoga therapy, in addition to psychotherapy, is it's in the body.
That's right.
The issues are in the tissues, right?
Exactly. And thank you so much, Amy, for your work, because the Optimal State of Living assessment tool is so helpful to me as a yoga therapist. And
thank you. And like you said, it's nothing that hasn't been out there for thousands of years. I just put it in a really tight package that is easily understandable for both the client and the yoga therapist to communicate with. So, I don't take credit for the ideas behind it. Just the way that it was packaged to help make it very simple is really the only thing that I did. So, all right, Melaney. Well, thank you so much. This has just been such a deep conversation, and I feel like the people who see this and hear what we're saying, those will be the people that will be attracted to us, because it really is deep, profound work that we're talking about.
And it's beautiful work. Thank you so much for your teaching, Amy. You really.
Thank you, Melaney. I'm so happy to have you with us on this journey.
Yes.
So, thank you.